Hello, I get a lot of patients asking for different kinds of facelift surgery options, and they get confused a lot of times, asking about what is mini facelift, what is facelift, what are different options for neck lift, corset corrections, what is mastectomy, SMAS plications, and so on and so forth. So these are so many scientific terms which sometimes patient gets confused and don't understand what each term means and what each surgery delivers. I'm Dr. Rajat Gupta, board certified plastic surgeon, having experience of more than hundreds of facelift surgeries, and here I am talking to you to explain you what are different options of facelifts, how to get a much more natural result after the surgery, keeping the surgery as simple as possible. So, first of all, let me explain you why some results of facelift surgery you will feel look very natural and some don't. Why some results last longer and some don't. So understand, in our face, essentially, there are four layers: a bone, the muscle, the fat, and the skin. Nerves and vessels are distributed in between. And as we age, everything falls down and medially. That's what aging is causing. Now, there are lots of ligaments which are attached from bone to the SMAS layer, which is the superficial layer of muscle, to the skin. So, as we age, these ligaments become lax and fall down, and hence the skin falls down. That's why you get sagging skin. At the same time, you may also have fat atrophy. The fat may decrease in certain areas of face, and that can be improved by putting fat or fat grafting. So, fat grafting is an essential component of modern facelift surgery so that the result looks much more natural. Now, as I explained, that the ligaments and the muscles are falling medially and hence the skin is sagging. It's very obvious that you tighten these ligaments and the muscles so that the skin just redrapes over it and gives you a much more natural result. Hence, what a modern facelift means is that tightening of muscle or a SMAS layer, which is the superficial layer of the muscle. We do not tighten or do not give the tension of the tightness on the skin. Skin is allowed just to redrape over the tightened muscle. Hence, the result looks much more natural. Now, if you do not tighten the muscle and just tighten the skin, the result looks like a blown out face. You know, the wind blown out face, which looks very unnatural, and someone starts looking like a caricature. That is what happens once you do a too much tightness of skin. It doesn't look natural, and I personally do not like it. As well as the scar tends to become much more obvious because all the tension of the tightness is borne by the skin. Hence, the modern facelift involved muscular modifications of SMAS as well as some uses of fat to improve the natural contour of the face. Coming to what kind of modification of muscles. So if you're talking about face, there are two modifications which we can do. One is mastectomy or SMAS plication. Mastectomy means we remove a portion of the SMAS and tighten the edges of the SMAS so that the SMAS gets pulled and you get a lifting effect. SMAS plication means you just tighten the existing muscular layer without removing a portion of it. SMASectomy is used in patients which have a lot of bulky face because we want to reduce some bulk. SMAS plication is used in certain patients who have slimmer or a smaller face and would do good with addition of some bulk. So, a good plastic surgeon would be well versed with both mastectomy and SMAS plication techniques to choose depending upon what a patient needs and their requirements are. And hence, they give you a much more natural and long-lasting result as the skin redrapes over the new SMAS structure so that you get a good result. Now, what is the muscle underlying the skin of the neck? Underlying the skin of the neck, the muscle is called as platysma. Hence, platysma plication is done to give you a nice neck lift result. Obviously, once the face improves, the neck is also going to improve a bit. As you lift the face, the neck improves. But to give you a much more coherent result, if you have sagging of skin, you need a muscle plication even in the neck. And that muscle is platysma. So, if you have lateral platysma sagging, you will do a lateral platysma plication. In certain individuals, they have central platysmal bands and which are much more prominent here, and then they need a central platysma plication, or also called as corset platysmoplasty. So, what we have talked about right now, that in face and neck lift, you get a much more natural, long-lasting and robust result if you tighten the underlying muscle. In the face, we have talked about two options of tightening the muscle, either a SMAS plication or a SMASectomy. And in the neck, we have talked about platysmal plication, either only lateral or also central. Now, the other confusing terms in facelift is a mini facelift or a full facelift. Now, traditionally, mini facelift means a lifting of the lower part of the midface and the jawline. Now, this part of the midface and the jawline is called as a mini facelift. It also means that the extent of dissection in the facelift is minimal, hence the term mini facelift. A full facelift means the lifting just below the eyelids, the upper cheeks, the lower cheeks, and the jawline. Many times, surgeons, when they say full facelift, that automatically includes a neck lift, because you can't just need a facelift to be done with ignoring the neck. Understand, anybody who sees you, they sees the full face and neck, and a lifted face with sagging neck will not look good. So a full facelift means a full face and the neck lift. Now, this was my attempt to clarify some of the most commonly used terms when someone is looking for a facelift surgical options. They get confused between a mini facelift, a full facelift, a skin-only facelift, a SMASectomy, SMAS plication, platysma plication. So, I've tried to explain you what all these terms mean and what they achieve. If you have more questions regarding these scientific terms and what you need for facelift, please write in to us and I'll be there to help you. Thank you.